but I do want to thank you, Dr. Nkume Sobe Jr. I never used the junior part, but nevertheless, it's your name. Joining us are a lot of my church family and friends from Rochester, but we also have people from Westchester, people from anywhere. I just kind of put the link out there, and we're joined by different people. And sort of the theme for today's presentation or interview really is the benefit is on the benefits of physical therapy. I don't know about the audience, but certainly for myself, when I think physical therapy, I usually think of, those who are injured or, sports injury or the elderly, right? But I think, as I've spoken to you and as I've done my own research, I think it's a much bigger field than just the sports injury and the elderly. But before we get into that, and I'm sure you have a lot to say in that regard, I want you to tell us a little bit about who you are so that the audience can familiarize yourself. And don't forget to include Rochester.
Yes, of course. I mean, born and raised in Rochester, New York. Cameroonian is my background. Both of my parents are from Cameroon. I'm a son, husband, father of a 4-year-old little girl. Much like you, a family man. So moving down here, I've been in Miami, Florida for 10 years, organizing and growing, developing the therapy practice. And here to help out a lot of people in a major way.
I appreciate that. Now, as far as physical therapy, tell us a little bit about, what got you into that particular field of healthcare.
Yeah, I mean, I've always loved, helping people in any way possible, and especially healthcare related. Went to school originally to be a pediatrician, and then veered into therapy because I really wanted to develop the human body, study injuries, study the anatomy, physiology, and be able to rehabilitate, post-injury, post-surgery, and then that quickly segued into the elderly, population, and then that really grew the passion. There's nothing more rewarding than being able to reinstill someone's independence. Reducing pain is one thing, but getting somebody to be able to walk again so they can go home to their spouse and live independently again. Well, that's a whole nother kind of reward.
Amen. Excellent, brother. So as far as physical therapy in the grand scheme, because oftentimes when you think healthcare, there tends to be a bias towards just the typical see a medical doctor, maybe go to a pharmacy and pick up your medications. That seems to be what comes to mind, at least in my experience. And then you have niche fields such as physical therapy. In your opinion, what's the role of physical therapy, or what's the significance of physical therapy in the grand scheme of healthcare?
Yeah, I mean, that's actually a loaded question, because I believe that we need to evolve as a profession, as a discipline. And by evolve, I mean, create a paradigm shift to become more of a preventative, proactive profession rather than reactive. Rather than only coming to us when you have an injury, we need to be that annual checkup, just like you go to your dentist, just like you go to your mechanic, just like you go to your doctor for your physical. You need to go to your physical therapist to make sure that everything is still functioning the way it should. Pain wise, posture wise, gait, strength, balance, endurance. The list goes on and on of what we can identify to mitigate any kind of decline or catastrophic event from occurring in the first place.
Excellent. Now, you mentioned something that stood out to me. You mentioned pain. And in my field, pain is often one of the biggest reasons why people get addicted to narcotics, right? Because pain is something that's often subjective. You go to your doctor and you tell him or her that you're in pain. There's no real way to measure that. There's no real way to assess that. Like if you were to say that you got your blood levels read, and your doctor can read the lab work and say you have high cholesterol, low cholesterol, you can measure blood pressure, you can measure heart rate. Whereas pain, a lot of it is subjective. It's based on how you feel. And so you just sort of had to tell, your physician that, look, I'm in a lot of pain, a lot of back pain. Now, of course, that segues into, we have a huge, narcotic abuse problem in the United States. Millions of people, get addicted, unfortunately, to narcotics. And many a times it's just a chronic pain. Physical therapy seems to offer something a little different than just medicating yourself in terms of rehabilitation. Can you expand on that?
Yeah, I mean, the physical therapy field in itself is all functional. It's all positions, differential diagnosis. Why is the pain occurring? When did it occur? When did it start? Was it in an event like a car accident? Was it a fall? And then once we assess and make the determination as to why the pain occurred in the first place, then we can treat it and reverse that pain and reduce those symptoms. Again, opioid epidemic is just masking the symptoms. It's not actually addressing the condition. So that's what we focus on, is actually focusing, identifying the condition and providing the intervention.
Excellent, man. Listen, here at the Self-Care Forum, the name of the podcast, for those who've joined us and who've been with us for, the months that we've had this podcast going, I think they know that I am a huge believer in prevention. And that's one thing that we often harp and we often, emphasize here is how do we get to the root cause of said problem? And how do we address things so that we're not constantly dealing with a chronic disease for the rest of our lives? And, I like that, and I really want people in the audience to notice that, look, if you're someone who struggled with chronic pain and, the only solution seems to be, look, take this pill, it's incumbent upon you to look for another solution, because there's only so much that, a medical doctor can do in that regard. They're not going to necessarily do any adjustments or any exercises with you, right? So at some point, if all you keep getting are pills to deal with, chronic pain that you're doing, I think it's time for you to look for, let's say a physical therapist or something, and see what they can do for you, what they can offer. Because chronic pain is something a lot of the elderly, not even the elderly, but, adults are struggling with. It seems to be ubiquitous everywhere you look, and people are popping Advils and Tylenols without fully understanding the side effects that this will have on them and their intestine and stomach and everything. But what's a typical day for you like? What are some of the situations that you're dealing with? What are some of the cases and some of the services that you offer that you find down there in Florida?
Yeah, I mean, to touch on what you just said, in its most general term, easiest to understand, physical therapy can really be as simple as thinking about one of your tires balding, and it's just one. It's just your front right tire, and you got to think about why is that occurring. So that's indicative of the pain that you're feeling in, let's say, your upper right neck. Well, there's an imbalance going on. So you go to your mechanic and get your tires balanced. Same thing with physical therapy. There's going to be some kind of malalignment. There's going to be some kind of functional strength imbalance that needs to be addressed and assessed. So a typical day, again, our main population is the elderly, primarily in assisted living communities. All over the state of Florida, soon Virginia and New York as well. And really, I've focused in, like you said, physical therapy is a niche field. Well, I went even more niche than that, because that is a population that is, in my view, very underserved. They're leaving their homes where they were, let's say walking the dog, taking out their own trash, doing the dishes, making their bed, cooking their dinner, but now they go to this stationary cruise ship, essentially, is an assisted living, where they have all the help, all the support, all the amenities, you name it. Well, now if you're not doing that much yourself, if you don't move it, you lose it. And now that functional decline occurs. So you went there with great expectations, like, wow, this is going to be fantastic. Well, pretty soon you decline, and now there goes your balance, there goes your strength, you have a fall, and now that's a cascading event. So we serve that kind of community. We do our reassessments. We want to make sure after year 1, year 2, year 3, year 4, you look exactly the same way functionally as you did the day that you moved in, and you need that oversight.
And that really speaks to the damaging effects of a sedentary lifestyle.
Exactly.
The idea that, being lazy, I don't want to call anybody, I don't want anyone to think I'm insulting them, but, just not being productive, being lazy or a couch potato, however you want to word it, the broader term is sedentary lifestyle, just not being active in life.
Right.
It's one of the biggest contributors to chronic disease. Right. It's linked to obesity. It's linked to diabetes. It's linked to all of these things that we are currently struggling with in U.S. healthcare. And so I think it's relevant that you mention how, a lot of times when people go into nursing homes and they stop they essentially give up the autonomy that they once had when living at home, they begin to lose their typical function. I think that's very telling. And, but in your case, what's one advice that you would suggest for, people that typically are, living a sedentary lifestyle? What would you say? Because it's very easy to tell somebody, look, eat right, exercise, get out there and run and do whatever. But I think it has more weight when it comes from someone who actually deals with this on a daily basis. What piece of advice would you give to those who may not be as active as they should?
You might be, expect me to say, oh, go for a nice little walk or go for a run. No, I'm actually going to say, don't ignore the warning signs. Don't ignore the red flags. Your body shouldn't be treated like your car where you got that, oil change light on and, you're just ignoring it week after week, month after month. You only have one body. And you got to take care of it. You got to be proactive and preventative and take care of yourself. So when you do have any kind of symptom, whether it's, a balance issue, nagging pain, a limp, anything, go get that checkup, go get that referral for a physical therapy visit so that that differential diagnosis can be assessed and the proper intervention or referral to another kind of provider can be addressed. But just don't ignore the warning signs. That would be my advice.
Excellent. And to the point that you made earlier, you alluded to the car and, how you have, having symptoms is akin to signs going wrong or your car letting you know there's something wrong. Mm-hmm. And I want to take that same analogy and really just address the drug use or the overuse of medication in this country. I think we all know that Motrin and Advil and Tylenol, they're very good things, but in terms of pain. But I like to emphasize to people that, look, they are symptomatic, right? It's like putting a Band-Aid on a situation. It's not going to cure. It's not going to address the root cause. And so a car analogy that I've heard before is akin to, let's say, for example, you're driving down the road and your check engine light turns on. Now you can pull over, unplug the cords that turn it on and still drive and go on the rest of your trip. Guess what? You unplug the check engine light. So now it's no longer flashing. It's not bothering you anymore. And you're driving your car like nothing's wrong. And that's akin to taking, your Motrin, your Advil, your Tylenol for, the pain or the headaches or whatever the symptoms are. However, what a lot of people fail to understand that over time, those symptoms will manifest in some sort of disease that's actually worse than the warning signs, right? So if you keep driving that vehicle while ignoring the check battery light, at some point the battery is going to give up and you'll be left stranded in the middle of the road. And I think that's where we find, that a lot of Americans are struggling with chronic diseases. Someone doesn't just sneeze on you and you get diabetes, right? You don't, someone didn't cough on you and you got, high blood pressure. Those things came and there had to have been sign. And unfortunately, a lot of people may not necessarily know or recognize what the signs are. But I think if you have a situation where people are a little bit more educated about their bodies and their health, and they can recognize these signs, they can be proactive and actually be preventative with, regards to, more severe issues or illnesses down the line. So I think that analogy is very relevant to this. But tell us about Sobe Rehab Innovations. Tell us about your business. When did you start it? Why? I know that you're down there in Florida, but what inspired you to, start your own as opposed to working for, somebody else?
Yeah, it's a good question. I think it was back in 2012, when I started the organization. And the main goal was, again, to create that paradigm shift, one patient at a time, to veer more towards prevention, veer more towards, proactive therapy, and see what it can evolve into. At that point, I had no idea that I would be doing what I'm doing now, to be honest with you. But that was the origination. Worked in every single kind of setting, hospitals, long-term acute care, nursing homes, residents in their homes, you name it. And now we've really, taken all the holes that we've seen, throughout these years, and addressed them. All of the ways to make sure that the patient is happy and well taken care of, their family who's up in New York or California, they're happy, reducing healthcare costs significantly, by making sure that the residents are kept happy, healthy, and home, not having those falls, those fractures, those costly hospital stays, rehab stays. No, they have their couple days of therapy every week, and they're doing their own thing independently at home, and that's the way it should be. So really, the dream was creating that paradigm shift, and that's what we're doing. Started with one patient, and now we're up to 200-300. So
Wow.
we're on our way.
Wow, we need you here in Rochester, Doc. We need you in New York,
Be there
somewhere,
soon.
Westchester, it doesn't matter. No, but that's awesome, brother. I'm proud of you, and I'm happy to hear that you're moving forward. Now, with regards to, you touched upon healthcare costs,
Mm-hmm.
right? Prevention is really, the way to go. I think in the U.S. we spend about 17% of our GDP just dealing with, healthcare.
Mm-hmm.
And not to get too deep into it, but a lot of it goes towards waste. A lot of it goes towards just unnecessary things. A lot of it is relevant and necessary, but we emphasize the role of prevention in terms of just its cost saving effect. And I think that's something you're seeing. Can you elaborate a little bit on that? How much, I don't know if you know an exact number, but how much does a typical person save, seeing you as opposed to falling down and then being hospitalized? Maybe you don't know the exact number, I don't know, but what's the, I imagine, they're saving a lot of money in just utilizing your services compared to what they would spend if they were hospitalized, correct?
Correct. Fortunately, I do know those numbers.
Oh, great.
I mean, so we conducted a study, because as we're expanding, scaling, we wanted to know that we're not just going to, go out there and say, hey, we're great, use us, partner with us. No, we wanted to know, what we're putting out there, and that our product is actually working. Our systems actually, create a change, to create a difference. So what we did is we looked at one of the communities we've been in the longest. We looked back 5 years in this community, and we grouped all the residents into two groups. Group A were the residents that engaged in our comprehensive therapy model, and Group B are the residents that never did, whether they refused therapy, their insurance was an issue, their family refused, and so have you. What we found was Group A had over twice as long of a length of stay in that assisted living facility by over 129%.
Wow.
Group A also had an 82% reduced hospitalization rate than Group B. And Group A also had a 37% reduced fall rate than Group B. So let's touch on the 82% reduced hospitalization rate.
Mm-hmm.
So these residents, if they go to the hospital, that's anywhere from $5,000 to $10,000 per day when they're in the hospital.
Wow.
Talking about an average length of stay in the hospital for about 10 days. So you do the math on that, you're talking about $50,000 to $100,000 for that one resident.
Wow.
And then once they leave the hospital, oftentimes they would need a rehab stay. And that can be anywhere from, $2,000, $3,000, $4,000 per day. And they're there for 10 days to 100 days. So this is unbelievably costly for the healthcare system, when all of that could have been prevented with simply having 2, 3, 4 days of therapy per week, which is about $100 a day. So the cost savings is astronomical. So that's all we can do as a profession, is conduct those studies, show those numbers to prove that what we do works, and what we do can save the healthcare system significantly.
Impressive. And that's a lot of money, brother. That is a lot of money. So how do you go about getting somebody to become a patient of yours? So do they have to have, a history of falls, or is this something that you just propose to residents and those who may be interested join? What are the criteria to become one of your patients?
Correct. So anytime a resident in these assisted livings has a fall, that should be addressed. So the nursing staff would refer that patient to us to identify a root cause analysis. Why did the fall occur? How can we prevent this from ever occurring again? So we do that analysis from top to bottom. Also, if the doctor might have referred them because they've had a decline, their strength isn't as good as it used to be, their walking isn't as good as it used to be, they're seeing them a lot more unsteady, they're not able to stand up like they used to. All of those signs are paramount to identify early before a catastrophic event occurs. Because let's just talk about mortality rate when it comes to falls. Residents that are over the age of 65 have a 50% mortality rate within the first 2 years.
Wow.
That end up having a hip fracture from that fall. So it is unbelievably important to address that and prevent that at all costs.
Right.
So again, that advice is not just identify the red flags and the warning signs, but you should ask yourself, am I able to do today what I was able to do 2 years ago, 3 years ago? If the answer is no, then let's get some physical therapy, because we can elevate your functional capabilities.
Right, and that doesn't just apply to the elderly. I mean, that applies to young. That applies to adults. That applies to folks in their 30s, 40s, 50s. So what? Without I'm not trying to sound like an alarmist, but when should someone consider adding physical therapy? Now, you've given us sort of like the things to look out for, but it seems to me that again, physical therapy tends to be affiliated or linked more so with the elderly due to the falls and the rehab, and especially those adults who may be physically active in sports. But when should somebody, an adult, let's say, around what age range do you think would you suggest people start looking into physical therapies?
I mean, like you said, age is completely removed. It's all about, can I do now what I was able to do before? Very simple question, and is that incapability, that new incapability, affecting your day to day? So you need that addressed. I mean, I give myself therapy in some way every day, whether it's tightness here, whether it's a weakness there. an imbalance there, a little bit of pain here, you address it, because again, you don't want that to compound, cascade, and snowball into something even more detrimental.
Sure, sure. Now, look, I'm sure I'm not the only one who's thought about this, or maybe who's had some confusion. Physical therapy, physical therapist, and chiropractor, right? We know that both of them tend to do some sort of adjustment to the body, to the human body. What are the differences, in your opinion, between the two, between what you do and maybe what a chiropractor does?
That's a great question. Definitely with physical therapy, we take a holistic standpoint. We don't only do adjustments and manipulations, but also we're going to look at things from top to bottom. Where is the imbalance, strength imbalance, range of motion imbalance that has caused the issue at hand. And again, we do a large host of treatments, like you said, you saw on our website, from ankles all the way up to the neck, lymphedema, aquatic therapy, strength and balance therapy. I mean, we do it all, while chiropractors more of just specialize in the spine and joints.
All right, thank you for clarifying that. So just going back to you a little bit about your personal life, where did you get your degree? Where did you get your education? Tell us about that. We know a little bit about how you got into physical therapy, but where did you go to school?
University of Buffalo.
Okay.
Go Bulls. Yeah. Yeah. Did undergrad there, graduate school, fantastic institution. I mean, they really end up generating and fueling top-notch professionals. I mean, I couldn't speak more about the preparation that they had us, as we hire some new therapists, these days, and, a lot of people want, training in this and supervision, and, but with our curriculum, man, they had us ready to run a building by the time day one out of school.
Wow. Now, from Rochester to Florida, what brought that about? Was it just because Florida is known to have a large elderly population? Was that one of the draws, or was there something else that prompted you to move down there, that drew you down there?
I mean, therapy also has what's called travel assignments. So I started off doing travel therapy, wanted to bounce around city to city, see where it was the best fit to call home. And, first it was Tampa, Florida, and then moved to Miami, Florida. And, definitely Miami, Florida's home.
Excellent. Now on your website, I want you to give out your website, SobeInnovativeRehab.com. On your website, you actually have some ebooks that you give out. And, I took a look at them. Great information, powerful things that, I certainly want to encourage everybody here to take advantage of. Maybe if not for you, but certainly for your loved ones. I think one of them is called Naturally Relieve Your Back and Neck Pain. Another one is called You Can Stop Sciatica Pain, 5 Simple Exercises for Sciatica Relief. Another is Naturally Relieve Your Hip, Knee, or Leg Pain. These are ebooks that you certainly give out to the audience. I want you to share that information with everybody, and I'm certainly going to post the link in the chat group for everybody to who may be interested to go in and take a look at that.
Yeah, I appreciate that. I mean, it's all about content, content and education. That's how we can improve our lives across the board. Doesn't matter what it is. The more the more you can help yourself out appropriately. So as much education as possible, we try to get out there on our website, interviews, YouTube, to help people.
Excellent. Listen, I want to thank you for this interview, Dr. Nkume. I certainly want to open up to the audience. I know usually they have you know, they have questions they want to ask you, we want to let the audience know. You can unmute yourselves, and you have the doctor's attention, and certainly he'll do his best to get back to you. If anybody wants to contact him privately, you know, you can put your number or email in the chat so they can reach out to you. But I want to open it up to anybody who has any questions, whether it's for you personally or for a loved one. You know, go ahead and ask the doctor. He's not charging y'all, folks. All right, take advantage of this, because what's the going rate for per hour?
Man, it's up there.
Up there. All right, guys. Does anyone have any questions?
I have a question. Do
Hi,
either
Sister
one
Linda.
of you have any suggestions or treatments for somebody with migraines?
With migraines, that's that's a really good question. You know, and when it comes to migraines, again, you know, you're talking about differential diagnosis, and by that I mean it could be a blood pressure issue, it could be a tightness in your cervical musculature issue. It could be a lot of different things. So you'd want to first see your primary doctor. Primary doctor is who will give you the referral for physical therapy. I mean, in most states, also physical therapists are direct access, meaning you can just walk right into a therapy clinic. But you'd want to get that differential diagnosis to see why you're having the migraines in the first place. And then once you've made that assessment and had that determination, then we can treat it with intervention.
This has been something that's been going on since this person was like 10 years old. They were diagnosed it. So they just told him to go on pills, like Excedrin or migraine headache pills and stuff.
Right, right. And have they seen a therapist for it, for the migraines?
No. So that should be the next step then.
Absolutely,
Okay.
absolutely. It could be a range. It could. Some things are so simple. It could be a range of motion issue.
Okay.
You know, a tightness issue, an imbalance, and it could be a host of things. That's why I said that's the differential diagnosis. It could be, you know, 10 different things. You know, so then we test it in this way to rule out that diagnosis. We test it in that way to rule in this diagnosis, and so forth. But like this is what, you know, the doctor was just talking about, being too quick to throw a pill at people and to mask the issue. And you're talking about 10 years old. I mean, no, that's, you don't want somebody to be addicted to narcotics, you know, at the age of 10. You need a physical therapist to take a look at it, to make that determination of what the next steps could be.
Thank you.
Yeah, great question, Linda. Great question. Does anybody else have any questions?
Yes, I have a question. I caught the last part of where you mentioned about lymphedema, and for a person that has it in both legs and part of the right side, and I want to know, is there any way of reducing, have it reduced or get rid of? There's a way to get rid of. It keeps swelling and it deflates, it swells up, deflates. So it's a constant nag all the time. And I want to know, what is it specifically? And it's not being explained, and I would like to have it, you know, more detailed in what can be done and how I can go about get it taken care of.
Yeah, so now you're talking about, you know, an exacerbation of the inflammation in your lymphatic system. You know, just your body, whoever, you know, you're referring to, is just keeping a lot more fluid than it should be. You know, it might be a reaction to something ingested, you know, liquid, food, etc. And the body's now has a new incapability to drain out that fluid. So the different ways that, you know, lymphedema is treated is most commonly 4-layer wraps to reduce the inflammation. Once the inflammation is reduced, then, you know, we apply stockings so that you have more independence with the inflammation. But also a root cause analysis. Again, you want to determine why is it occurring in the first place? Why are the migraines occurring? Why is the lymphedema occurring? We're not just want to put you on a pill like Lasix to reduce all fluid in the body, again, masking the issue of why it's occurring in the first place. You know, some people, just simply a glass of wine can send them into a spiral of lymphedema. They don't realize that their body is allergic to any form of alcohol. I mean, that's just something very simple that people might not understand, and they just want to treat the fluid, the excess fluid, rather than understanding why the fluid is there in the first place.
I was told also that at the process of being labeled, that I had overhydrated myself to a point where it sent the body into, he called it the mechanism, that it is a balance, and when you knock it off, it throws everything off. Is that true?
Overhydrated with water, you mean?
Yeah.
Hmm.
It happened while I had a stroke, and I wasn't able to walk or talk or speak to anybody to let them know there was something going on. So in order to eat, I couldn't eat anything because I didn't know how to, I couldn't get myself up. So I would just drink fluid all the time. And it was water. And I overhydrated myself to, when they did find me, it was too, you know, there was a lot of things going on. They had to get me to walk, they had to get me to talk, and to get sentence out of me to make so that I could explain what was what was going on with me. They asked me a lot of questions, but I couldn't answer because I didn't know. So time went, 9 weeks went by, and then a couple months went by, and then that's when the testing, the minute I was able to explain, what took place, they realized I had a stroke, but nobody knew it at the time. And I didn't know how to relate that to anybody. You know what I mean? I couldn't talk or anything. So it took a long time. So I didn't know how to, I had lost my memory ability, and I didn't know how to cook or eat, and didn't know anybody's name or the phone numbers or anything. So during that process, I just drunk myself to kick the hunger part of it.
Well, Mary Lou, let me ask you this: Have you seen?
This is her sister, Norma.
Oh, hi, Sister Norma. I've got a question for you. Have you seen a physical therapist to try to do some of the things the doctor suggested?
Yeah, I, for the past 10 years, when they finally found a person that was willing to deal with it, because it had developed into, what they call them, when the skin breaks open and the fluid start leaking out. There was nobody willing to deal with that. That it took a lot of time, and they was just wrapping it, and they found out that the wraps they were using was causing it more harm because I was allergic to latex. And so it was doing more damage than what they were doing. So it took a lot of process. It's been over 10 years now. And they just found something right now that I can use to put on my legs to wrap them up and still use the machine to do the pressurized thing morning and night. And it's just happened this year.
Wow. That's
okay.
That's a lot. Go ahead, Doc.
Yeah, so you're currently using the lymphedema pumps?
Yeah.
Okay, and you're seeing success with those pumps?
The success didn't start till about 3 weeks ago. Even I had the pump first, but what they found out that the pump wasn't really working unless I had the what they call them, it was like a uniboot, but the braces wraps. So when you when you wrap them and then you put on the machine compressor, then I started seeing difference in my legs now. So it's been over 10 years process.
Got it. And okay. Yeah, definitely would love your contact information so that we can discuss things more in depth.
Okay.
Yeah, by the way, I put Dr. Sobe's contact information in the group chat. So please, certainly click on the link to his website where you'll be able to download the free ebooks. But also I have his phone number and his email, his business email. So feel free to take advantage of that. But thank you, Sister Norma, for those questions. Very insightful. Does anybody else?
Yes, hi. I do. Yes, I have been suffering with a lot of chronic pain. I had chronic pain for quite a while before they realized that I do have rheumatoid arthritis. At first, they said it was lupus. They treated it as lupus, but I'm gotten better with those type of things, but I'm experiencing a lot of discomfort in my right lower back or hip. I'm not quite sure which one it is. I have seen a physical therapist. However, it just got a little bit expensive to continue this therapy. So I do try to do the exercises that I was receiving at the last visit, but I'm sure there's probably a next level I'm supposed to do. But I find that I'm just having a lot of pain in that right hip, and it's more or less how I sleep or just sitting up. And I work in preschool, so I'm working in lower chairs and things like that. And I think that attributes to it as well. But I was wondering if the doctor has anything that I could do to relieve some of the pain in the hip. I'm not an advocate for pills. I rather suffer through the pain than take a pill. So I'm just trying to find other ways to remedy the problem.
Okay. Yeah, I mean, you touched on a lot of things there as far as work ergonomics being a factor, your bed. A lot of people don't realize that the mattress changes can be so detrimental. If the mattress isn't agreeing with your body. You mentioned that you've been seeing a therapist, but it's become too costly for you, so they have you doing some home exercises. Was your treatment with the therapist beneficial?
I think so. She was very good. The exercises she has given me are not hard to do. It's just consistency. I know that. But when you mentioned the bed, I think that is part of my problem. But I do just, like I said, it's depending on how I sit. And at first, I thought it was my tailbone because all the pain is in lower back. It's isolated to the right side of my body. But the therapy was helping. I believe it was. So that's why I'm trying to just figure things out that I could do at home. I need to get back. I do realize that. But in the meantime, what can I do just to alleviate the pain when I'm having the pain in that moment?
Right. So I would definitely, I mean, you touched on consistency with your home exercise program. So if you've already been, experiencing benefits with your current physical therapist, then if they've prescribed you exercises to do at home, definitely stay consistent with those, and also ask them how those exercises can then be progressed for you to really take ownership in the home. And then you see how that can be beneficial over time, and if something needs to be adjusted. But if things are beneficial for you, then we definitely want to stick with that and not veer off and start trying something new when you've already been seeing a therapist for some time and have seen some good outcomes.
Well, one real quick question. How do you determine if it's not displaced pain? I have, like I said, I was having a hard time sitting on anything with my tailbone. So I thought it was the tailbone. Then the therapist, I guess, I don't know if my x-ray shows something, I can't recall, but like it's the tailbone sometimes, and if I shift my weight on my left side, I feel more comfortable. So how do you know exactly if what you're being treated for is really the issue?
It's a great question. I mean, that's all about the differential diagnosis, like I was referring to, ruling in and ruling out something being potentially valid or false. So when you're talking about arthritis versus sciatic pain versus disc herniation, everything is going to have a different presentation based on body position, based on the referred pain. So the body really speaks to what's exactly going on. So when you're asking your therapist, when you conducted the differential diagnosis, what did you determine? Is your diagnosis the same as my doctor's diagnosis? That's when you know. And also with imaging, so therapists, we, end up doing x-rays with our hands and with our eyes and with our minds. But you can take the next step, and that's to get an x-ray, to get an MRI, to see if everything is agreeing. If the doctor's diagnosis is agreeing with the therapist's diagnosis, is agreeing with your symptoms, and is also agreeing with the imaging that took place. And that's the way to know for sure what you're dealing with.
Yes, and what happened with me, they would not give me the MRI until I went to therapy.
Correct.
So I was going to therapy so that I could get to the MRI, but the cost of the therapy was hindering me from continuing. I do know I need to get back on that therapy road so that I can get to the MRI, but why is it so much that a lot of insurances won't go directly to the MRI, and they want you to do all this other things, pills, therapy, and other things just to get to something that really could help and maybe eliminate some of your uncomfortness?
But yeah, it goes, what the doctor was just referring to, where he said 17% of the GDP goes towards healthcare costs. So an MRI is thousands and thousands of dollars.
Yes,
So they would rather, give you a few pills that might be $10, $15, $50, or give you therapy that's, on average $100 a treatment, rather than give you a $5,000 MRI and have the MRI come up inconclusive, or have the MRI just saying exactly what the doctor already stated, arthritis. They would rather go the conservative routes first than, the aggressive, costly route.
Okay, thank you.
Great question. Great question, Cynthia.
Yeah, great question.
Somebody wrote in the chat, and I'm going to read this question by Amy. Can physical therapy help with psoriatic arthritis and fibromyalgia?
Yes, I mean, of course, we have a lot of patients with fibromyalgia. Depends where the pain is, when you're getting the pain. Again, root cause analysis to determine why it's occurring in the first place, how that can be prevented, how that can be mitigated with any kind of modalities or functional interventions that we have. But again, you have to see that physical therapist to conduct that assessment to determine the proper intervention. But short answer is yes.
Excellent. We have another question written in the chat. By the way, folks, feel free to ask them directly. I don't mind reading, but I take advantage of his presence here. But from VDM Charlotte, her question is, what is better for treating sciatica? Seeing a physical therapist or a chiropractor?
I mean, I don't want to toot our horn, a little bit biased. It's a little biased, but I mean, of course, a physical therapist, oftentimes, again, with sciatica, you're not going to need to do any kind of spinal manipulations or anything like that. It's typically just a tightness, whether it's piriformis syndrome, which is just a very tight muscle that pushes on the sciatic nerve. A large percentage of us all have a sciatic nerve that pierces through the piriformis muscle. So, stretching out that muscle, hamstrings and glutes, relieve sciatica in one treatment alone. And then you end up going home with, you know, the stretches and to do by yourself so that the sciatica doesn't come back. Same thing, like I said, with the analogy of a balding tire. You know, you don't have to, you know, crack the wheel. No, you just need to balance the tires, and that's it.
Yeah, and just to reiterate to the audience, you do have a free ebook called "You Can Stop Sciatic Pain: 5 Simple Exercises for Sciatica Relief." It's available on your website for free download. So if anybody is struggling with sciatic nerve pain, please take advantage of that gift, if you will. But thank you for that, Doc. I want to leave it up to the audience again. Are there any other questions? Oh, VDM Charlotte says, thank you so much.
Oh, you're welcome.
Does anyone else have any questions? Okay, I think we're good. I think we are, you know, I think we've sort of addressed everything that came up and oh, hold on. Hi, Anna, go ahead, speak.
Hi, how are you doing?
Hi, Sister Dankura.
Good evening, doing well. How are you?
Great, great. I recently had a problem in my right leg where it would wake me up at night. It almost felt like Charlie horses, but it was just like muscle spasms in my lower leg. And it happened and it was very painful. I had to wake up, I had to stretch, I had to walk in order to get rid of that pain. And I finally I went to the doctor. It got so bad I had to go to, I went to my primary and he referred me to an orthopedic. So I went to him and he said, well, that was one of the other things, but he referred me first to another doctor and he told me that I needed to go and get an MRI. I went for that. But before I went for the MRI, he gave me a prescription that he said it was for pain, but it treated other things. I got the prescription. The prescription came and it said it would be treating me for depression and other things, and I wouldn't take it. So I went ahead and got the MRI, and he said it was just basically arthritis in my lower hip and my legs, both knees. But now I went to the orthopedics, and the orthopedics, you know, he's saying I need new kneecaps, or physical therapy, or cortisone shots. What do you think? Well, listening to you, it sounds as though I should just go ahead and get the physical therapy first before I try any of these other things. Do you think that is the best thing to do?
Absolutely. Yeah, I mean, you know, all these stories are eye-opening, you know,
going on.
are eye-opening for me. That a PT referral, physical therapy referral should have been step one. You know, no medications, no MRI. What's an MRI gonna tell you about, you know, your calf and your knee? I mean, that's why a lot of insurance companies say, you know, MRI is the last resort, because they're great, but you just spend $4,000-5,000 just to get a one-word arthritis. That doesn't help you. You're still at square one. You know, so yes, definitely physical therapy. Again, you know, differential diagnosis with, you know, that kind of thing, restless leg syndrome, you know, dehydration, you know, overall just, you know, muscle tightness, you know, getting into a stretching regimen, you know, strengthening, you know, seeing what your activity is, you know, are you walking a lot that, you know, your calves can be overactive. You know, when you're saying your lower leg, you're talking about your hamstrings, you're talking about your calf, you're talking about below your foot. I mean, there's a lot that needs to be spoken about to know exactly where, why, how, so that we can determine what to do. But 100%, yes. Please, please, if anything comes from this talk, please see a physical therapist.
I will. And before that happened, I was walking quite a bit because I knew, I needed to get out and do something,
Right.
so I was walking quite a bit. So it
Exactly.
just, me started aching and I said, oh, I can't do it anymore,
Right.
and that was the stretching and everything. But even after the pain came, I would have to walk back and forth and back and forth and back and forth. And sometimes I take pretty close to 1,000 steps in the house a day, just to get rid of that pain.
Right.
So, okay.
Right. Yeah, it could be, just simple dehydration and stretching is honestly what it sounds like. That's very simple, simple fixes, in and out. You could do that and just, a calf stretch on a step or a curb, when you're doing your walking outside, make sure you're stretching those calves, stretching those hamstrings, because they will want to ball up and bunch up, especially if you're at all dehydrated. But very simple. Scratch the meds, scratch the MRI, all of that costly stuff, that drives insurance companies crazy.
Yes, and drove me $200 crazy too.
And drives your pocket crazy too. Let's not forget about that.
Thank you. Do you think, well, I guess from the physical therapist, they would let me know whether I need to go ahead and have the knees caps replaced, probably, right?
Yes, of course. That's very aggressive, to speak about, surgery and to speak about cortisone shots and MRIs, injections and medication. No, step one should be physical therapist.
Thank you.
Always. And when you spend a few weeks with us, a few months, and you don't see any benefit, then we can talk about those more invasive measures. But physical therapy is always the safest and most conservative and most cost effective, both for you and everyone else involved.
Thank you very much. I really appreciate that.
You're welcome.
Great question, Anna. Great question. Do we have any others? I think we have one question in the chat. This is regarding TENS unit.
Okay.
For those who don't know, it's these are pads that emit small voltage of electricity, and they're often used to sort of, I'm going to let you have it and go ahead and talk about it.
TENS unit is something to more trick the body that you're not feeling any pain, blocking the pain signals to the spinal cord, to again, trick the brain that you're not feeling anything. And over time, that success and that benefit can have, can grow from 10 minutes pain-free to 20 minutes to an hour, all the way up to a day. So that's why a lot of people might use a TENS unit at home, also cost effective and not invasive at all.
Mm-hmm. Thank you. Great question. I don't see any other. Follow up. For sciatica, which one will be more effective, a TENS unit or an EMS unit?
First, see a physical therapist, because maybe those units aren't necessary in the first place. If you're able to identify why the sciatica occurred in the first place, how it occurred. Once you do that assessment, then you have the intervention to reverse what happened. And then you're not going to need meds and TENS units and E-stim and all that good stuff.
Okay, so essentially it's see a physical therapist first, sort of get the underlying diagnosis, whatever may be causing the issue, and then you can proceed to using, let's say, a TENS unit for symptomatic relief, or an EMS unit, electric muscle stimulator, I believe it is, or even heat or ice. Am I right? Those heat pads.
Correct. And then you let your physical therapist that conducted, that differential diagnosis and that determination, you let them, make that decision, without doing a thorough assessment. I couldn't just say, hey, yeah, use heat. I don't even know what's going on. So that'd be malpractice.
Okay. And you got a thank you from her.
You're welcome. You're welcome.
Charlotte.
I did.
Yeah. Does anyone else have any questions, family? All right. Hey, Doc, listen, I want to thank you. I want to thank you for your time. Thank you for, taking your time, joining us from Florida, touching base with your family back here in New York. And, just sharing, really blessing us with this knowledge. Hopefully you've empowered those in attendance and those who will watch the video in the future. Hopefully you've given them a pathway into dealing with their chronic pains, their, sciaticas, their, psoriasis, there's arthritis, all these different issues that really we struggle with and we don't need to have a cure for, except for symptomatic relief. Hopefully you've given them something to think about, a different approach to managing these issues instead of just, again, relying on the pill or, over medicating themselves. Hopefully that's something that they'll take away from this. It's certainly something that I will take away from this. So I really want to thank you. Hopefully we'll have you again. And this time, I think the audience, they're going to come loaded, locked and loaded.
Right.
So, but I again, my gratitude extends to the audience. I want to thank each and everybody for joining us again. Being able to sit through this, your great questions. I may not be struggling with some of the things you all are, but certainly I'm gaining wisdom, certainly from the doctor and his suggestions and from you all and some of your experiences. So I appreciate that. And as always, the recording for this video will be on YouTube, as with all of my other videos, on this series, on the Self-Care Forum podcast. It will be on YouTube. So you will all have the opportunity, for those of you who may have somebody who wants to watch this, or you want to share this video with, you'll have the opportunity to give them the link and rewatch this and gain something from it. So I want to give the final word to you, Dr. Sobe, and certainly if you have anything you want to share before we finish off.
Yeah, thank you all for joining. This is definitely an informative talk. It was a lot of fun. I feel really good that, you guys were all, had meaningful questions, and I was able to help you all out. All those ebooks and a lot of education is on our website, on all of these hosts of questions, from fibromyalgia to sciatica to, knee pain, leg pain, on our website, Sobe, S-O-B-E, innovative-rehab.com. I know the doctor's going to put that in the chat below. So yeah, check that out. Knowledge is power, education is power. So if you have any questions later on that might come up, yeah, definitely reach out to me on my email as well.
Excellent. And so again, I've texted that, I've entered that information in the group chat. So that's for everybody to copy, the website, as well as his contact and phone number, as well as email and fax even. So please take advantage of that, copy that, family. Certainly, we look forward to having you all join us next time. And, until then, have a blessed night, guys. Thank you.
All right. Thank you. Have a good night. Take care.
Bye-bye.
Bye.
I don't know. Wait.